Hi, it's Dr. Keith Monchik from Orthopedics Rhode Island. I'm one of the orthopedic surgeons who has a subspecialty in sports medicine and arthroscopy. So I do mostly shoulder and knee operations, and I do a lot with rotator cuff tears, and specifically irreparable rotator cuff tears, or what we call the massive rotator cuff tear. So today I want to spend a couple minutes talking to you about a procedure that we call a superior capsular reconstruction, which is an option which we didn't have in the past for people who have these massive, large rotator cuff tears. To give you a background, the shoulder, as we know, is a ball in a socket. So you got the ball in the socket. On top of the ball are four tendons. Those four tendons make up our rotator cuff. The largest of these tendons, the supraspinatus, is really what allows us to get really the forward elevation in our shoulder and gives us a lot of the strength. Sometimes people tear the rotator cuff, and most of the times this rotator cuff is repairable by a simple arthroscopic procedure where we reattach the cuff back down to the ball and restore the stability of the shoulder. However, some patients, for whatever reason, whether it's a large traumatic tear or they've had it for a while, end up having a tear that some of us would call irreparable, where the rotator cuff is actually torn off the ball and it's retracted so far back that even arthroscopically, if we went in, we would have the inability to bring that cuff back down to that ball and restore the stability. For these types of patients, it depends upon the age group that this person is in. For really older patients close to their 70s, we have a great procedure, and that procedure is a reverse total shoulder, where we actually do a shoulder replacement to restore the stability and function of the shoulder. It's not a great procedure in a younger, more active person, someone in their 30s, 40s, or 50s who has minimal arthritis in the shoulder. As a result, these patients who have these larger rotator cuff tears, we've tried to find some other options to restore the stability and gain them the function and decrease their pain. So these massive rotator cuff tears nowadays are treated with something called a superior capsular reconstruction. So that rotator cuff, besides allowing the function of motion and strength in the shoulder, it's also designed to keep the ball down in the socket so that there's a good biophysics type of motion in the shoulder, and it allows that shoulder to move concentrically rather than eccentrically. In patients who have massive tears where the head has been uncovered, that head rides up in the socket, and we now have an eccentric socket, which isn't really good for function. So back in Japan, a doctor named Mahata, about 10, 15 years ago, developed a procedure where arthroscopically we can go in and we can actually place a patch in place of the rotator cuff, and that's why we call this a superior capsular reconstruction. We are reconstructing the superior capsule, or that supraspinatus, from scratch. We use a biologic patch. It's inert. There's usually no reactions to the patch in general. It's an arthroscopic procedure that we take about an hour and a half to do. What we do is we go in and we clean out all remaining tissue. We actually affix the rotator cuff or the patch back down to on one side to the humeral head and on the other side to the socket, and that creates basically a tarp or a trampoline over where that rotator cuff used to be. The good news is it is done arthroscopically. It's an outpatient procedure, and in about 85% of patients, it restores the function, the strength, and decreases the pain in a patient that normally would have had to have a much larger procedure for their, quote, irreparable rotator cuff tear. Patients are rehabbed just like a simple rotator cuff would be. We get them to get their shoulder moving pretty much within about 5 days, and hopefully by about 6 weeks are out of a sling and moving around. So it is a excellent option these days for patients who have minimal arthritis, who are young, who have a massive rotator cuff tear. And once again, the procedure is called a superior capsular reconstruction. If you go to the Ortho Rhode Island blog, there's a more detailed blog in depth written by myself that you can find some more details about. So good luck, and hope to see you soon.